Hello, everybody, and thank you so much for joining today. My name is Michele Grand. I'm a licensed massage therapist at Smilo Cancer Hospital. It's my honor and privilege to every week work with some of the most charming, sensitive, determined, and beautiful people every day that are going through all sorts of challenges related to their oncology treatment. It's also my pleasure to join with you today, whoever is logging on online, to just listen a little bit about neuropathy, peripheral neuropathy, and how some just simple massage techniques can help with the issues with your hands and your feet. A little bit of background. The peripheral nervous system carries signals from the brain and spinal cord to the rest of the body. Any problems along the way can affect the skin, muscles, and joints of your hands and feet and other parts of the body. Now, peripheral neuropathy is a term for pain and discomfort to the peripheral nerves, and those are the nerves that extend away from the brain and spinal cord. During treatment, chemotherapy can, of course, kill the cancer cells, but at the same time, it can also affect these nerves that connect the spinal cord to the muscles, skin, and internal organs. Certain types of chemotherapy affect small sensory nerves in the feet and hands, and that can, of course, cause numbness, tingling, and pain in the fingers and toes. This damage to peripheral nerves by these drugs is called chemotherapy-induced peripheral neuropathy, which you may have heard that term before. One or more of the symptoms may appear suddenly, but typically they build over time and they worsen with each dose of chemo, peaking at about 3 to 5 months after the last dose. The agents in chemotherapy, they tend to obstruct the capillaries in the fingers and toes, and these are, of course, are the furthest points in our circulatory system. When these nerve endings in the hands and feet don't get enough oxygen nutrition from blood circulation, they can become painful, sensitive, and numb. Less often, radiation-induced peripheral neuropathy can affect the patient or yourself several years after that treatment. And with the radiation-induced peripheral neuropathy, nerve compression due to soft tissue fibrosis, that may cause the nerves to become damaged along with the blood vessels. That's not as immediate effect as the chemotherapy, and it does happen much less often. So now we're going to get into, well, what can massage do to help with these symptoms? And each person dealing with this neuropathy has a completely different experience. There's no two patients that experience the same exact effects. So just know that what you're feeling could be different than what somebody else is feeling, but it's all a normal part of the process. And the massage techniques we're going to do today can aid a little bit in some of those symptoms. What are the benefits to this massage treatment for neuropathy? You may experience some increased comfort in the affected areas of your hands and your feet, and your toes and your fingers, a more return of normal sensation more quickly over time, and some improvement in your activities of daily living, such as walking, food preparation, handling of objects, and hobbies. I know so many of you that I meet, you have your hobbies, you like to draw, you like to garden, you like to cook. And I know it gets frustrating when you have these feelings going on. So hopefully this will aid and get you back to more of the things that you love to do. Just a few things to keep in mind. Now, deep tissue massage is not advised at all. Whether you're doing this massage on yourself or you're having a loved one or a friend do it for you, just always keep in mind, it's not like somebody, a friend of yours or a family member, they like to go for massage. I love deep tissue massage. The harder, the better. This is not the sort of massage that you want to do for your neuropathy. The skin could be very, very delicate. It could be a little thin. You could feel some swelling. You could feel some hardening, and you'll certainly feel some pain and tingling. So we're going to go really light and just adapt to your own personal sense of pain and to your own personal experience. If somebody's doing it to you or you're massaging yourself, just go with how it feels. You want to have a little bit of pressure, like you want to feel your hand moving along your skin, but you definitely don't want to feel any sensation of pain. And this massage can be done with or without lotion. That's to your preference. And if you use lotion, just something light and a very, very, very small amount. To get the most benefit from massage for neuropathy, ideally you'd want to do it daily for about 15 minutes, but whatever you have time to do is absolutely fine, and every little bit will certainly help. So now we're going to start with the massage on the hands. What we're going to do to begin with is just kind of warm up your hands just a little bit. We're going to begin by taking your wrists and just getting a little bit of range of motion going. Just go in both directions. And as we massage, just have a comfortable seated position, and just your breath should be relaxed and easy so you're not feeling rigid or tight or holding in your shoulders. The next thing we're going to do for the hands is we're going to stroke, beginning with the wrist and just up from wrist to elbow, just to get a little circulation going. So you can take the sides of your fingers, that's a good flat area, press in to the skin and the muscle. If you're not feeling any pain, or if you're watching this to help a family member or friend and you don't have neuropathy, you can go a little deeper and give yourself a nice massage today as we're working. Otherwise, just be mindful. And then turn to the other side. And again, from wrist up to elbow. Just get that circulation going. You might even feel areas that tingle a little bit. You could have some contracted muscles there yourself. Now, at the wrist where it connects with the arm, just make little circles. You can use your pointer finger, and you could even feel where the bone connects to the wrist. And just make little circles. And do that a couple of times. If you prefer to use the thumb for a little deeper pressure, go ahead and do that. Excellent. Now, when we get into the hand, there's a good sized little meaty muscle here. You just want to get in here and give that some pressure in a circular motion. Just kind of move the tissue around. The areas where you feel something like muscle, you can go a little more there. Where it feels a little bonier, you want to be a little bit more gentle. And just go ahead in circles. And you could even begin already to feel the blood flow. I'm going to turn to the other side, and we're going to go upwards from the wrist towards the fingers. Just bring that skin up. And again, if you're suffering yourself from neuropathy, or you're working with somebody who is, just be really, really gentle. This skin is thin to begin with. So light pressure is fine. Almost no pressure is also fine in that situation. You can get in here into the crease. There's an acupressure point here that can stimulate a lot of benefits to the body. So it's nice to go in here a little bit and work this little web area. Could even feel a spot right here that could be a little tingly and sensitive. You're activating that acupressure point. And then another really important area to help are the fingers. the fingers, sometimes it's hard to even bend them. They get so rigid. So wonderful results can be achieved from just kind of going up and down the finger. And go ahead and press there. If the person you're working on or you yourself experiences pain or discomfort, just lighten it up. But just get in there around the little bony joints, make little circular friction motions just to stimulate circulation and release of any connective tissue that may be sort of jumbled up in there. And then, of course, the tips of the fingers. And then give a nice pull. And you can go ahead and do that on each finger, even on yourself. This is wonderful. If you yourself are not suffering from neuropathy, but you have a little arthritis or just kind of sore fingers, this massage is very, very beneficial. Reduces pain, increases circulation. Just go all around, up and down, and motions around that little joint there. And the tip of the finger, and a nice pull. And just keep that going for every finger. When you do this on your own, take your time. There's no rush. 15 minutes is ideal, but we're just going to go through the motions today so that you have the routine that you can do. And the ring finger. Feel around the joint here. Any tenderness, just give a little circular friction. And up to the tip of the finger as well, and a nice little pull, and the pinky. Same. With the body, of course, it's always important to balance. If you're going to do one side, even if you have nothing going on the other side, always do the other side as well. So we're going to get the circulation going from the wrist up to the elbow. Just sort of wake up your body, let it know that you're going to be giving it some TLC. Good. Excellent. Very good. And around the wrist, just work a little bit around the joints. You feel where the connection is made at the wrist. Keep the breath relaxed. And then begin massaging the palm of the hand. Again, getting into that nice muscle meaty area here. And all the soft tissue. The other side. Not forgetting that little web area here, stimulating that acupressure point. And then attending to each of the fingers as needed, up and around the joints and the tips of the fingers very much. Sometimes you'll feel a little cold sensitivity there. So this will help to warm up the hands a bit, increasing the circulation again, that nice oxygenated blood flow. And we're going to continue with each of the fingers, just as we did with the other hand. Good. And the pinky, and give that a nice pull. Excellent. Take a deep breath, and just a second or two, just notice a little tingling, a little nice circulation going. Just take a moment and feel that. And that this is what's going to help moving forward with the symptoms that are experienced with the neuropathy. And again, spending more time will give you more benefit. But this is just an overview so that you can do the routine on your own at any time. Now we're going to get into the feet. It's a similar experience to what we did with the hands, but we're working with the feet, the toes, and the soft tissue done that way. I'm going to tilt my screen down so that you could see what I'm doing with my feet as well. So just like we did with the arms, we're going to first start, make circles at your ankles just to get a little range of motion going. Good. And then we're going to give ourselves a little massage the same way from the ankles up to the knee. Just to increase the blood flow, let your body know that we're going to be starting to work on this soft tissue and increase the circulation. And the same way, it's nice to use like this side of your finger because you have you can give it a little pressure. You have a little momentum here to press into the soft tissue. Again, if you're experiencing tenderness, pain, swelling, a tightness, super, super light, literally, it's fine to just touch the skin and just move it this way. So this is a very, very, very personal experience. No two people are going to have the same symptoms, and every massage is going to be different and catered towards your own personal needs. Okay, excellent. And again, we move in an upward direction. When we massage here, it's towards the heart. So we move the tissue upwards from ankle to knee. Now, as we get into the foot, we're just going to give it like a nice squeezing motion to begin. Just as we did on our palms, we're going to do similar on our feet. So we're going to just get in here and move the tissue around. We can go in a motion from the heel upward. We can go sideways from the outside to the inside. And you could feel a nice release. Sometimes there's a little knot here at the arch. So as you modify your pressure to your personal experience, you could just make like nice little circles here around the arch. Some have a larger arch, some have a flat foot, some have something in the middle. So just be mindful to what your experience is. So gently squeeze and massage the soft tissue. Now this area here, if you are experiencing peripheral neuropathy, right here at the base of the toes on the bottom of the foot sometimes is an area that is very, very constricted. And doing a massage here can be extremely beneficial to relieving some of your symptoms. So modifying your pressure as needed, you can go in here at the base of each toe and just make some circles around, a circular friction motion at the base of each toe. And anybody will experience benefit from this, no matter what the symptoms are, because this area sometimes does need additional help with some circulation. As you go closer to the toe, you may even feel little knots and a lot of tenderness. And to release that is extremely beneficial. There's acupressure points here that releasing them can offer benefits of circulation and oxygenation and just good energy flow. Going to the front of the foot, the same thing as we did with the hand. We're just going to make upward motions from the toe upward. A nice release. Excellent. And now attending to the toes themselves, just like we did the fingers, the same thing. Just little squeezing motions with each toe and a nice little pull. Do that with every toe. Excellent. And like a little pull when you're done. And a final squeeze. Excellent. Again, we're going to do what we did on one side to the other side. The body requires balance. And again, you could feel already in that foot, maybe it's warming up a little bit. It just feels good. Your breath is lightened. This is an excellent energy release. So again, we move the soft tissue from the ankle upwards towards the knee, modifying your pressure as appropriate. And just know whatever you're experiencing is your own personal experience, and it's fine. Everybody's reaction to chemotherapy is different. Some people experience neuropathy only when they're receiving their chemo. Some have it all the time. Whatever your experience is fine, and it's just a reaction to the drugs. And this massage hopefully will give you some comfort and relief. Good. And then moving to the foot, the bottom of the foot, we just give it nice squeezes, nice circular massage. Just really get in there to the soft tissue as appropriate. Circles around the arch. And then paying mindful attention to that area here below the toes. Often this massage will very, very, very quickly give you feeling again. If you have numbness, you may begin to experience like a tingling feeling, which is a good thing. And from there, you might say feel more sensation beginning relatively quickly after massage. And the longer that you do the massage, the more benefits you'll receive. And again, we don't want to forget the front of the foot. Excellent. And of course, the toes. Excellent. Each toe. And again, at the base of the toe, there's a lot of acupressure points there. You may feel little hard areas, and you could just spend a couple of extra minutes and just little light circular friction to release that, and then a pulling on the toe with each one. Very good. And a last squeeze. Okay, beautiful. All right, so just maybe take a couple of seconds here and just kind of see how you feel. You feel a little blood flow going to the foot now. Maybe you just feel your whole body a little more relaxed. And if you are experiencing some peripheral neuropathy, maybe you're feeling a little more sensation, a little less numbness, a little less pain. So this is, again, just an overview of what you can do. You can do this on yourself, which is wonderful. At any time, you can have a friend, a partner, a family member do that for you. Again, always being mindful of your personal situation, your level of pain, and the condition of your skin. In conclusion and in closing, we're just going to do a very, very simple exercise to ground. Take a deep breath and close your eyes. And imagine a beautiful white light entering the top of your head. Imagine that white light going down through your head to your chest, out both arms, down through your belly, down through your legs, and out to each foot and to your toes. And exhale. A deep breath in and feel that white light coming through your toes, up, back through your legs to your chest, from your fingers to your arms, up your chest, up your head, and back out the top of your head. And exhale. Okay, everybody. I hope that helps. Whatever you're going through, I wish you well. I wish you happiness. I wish you peace. Remember to drink lots of water, of course, healthy food choices. And just remember how unique and how beautiful and how special you all are. I love working with you. Thank you for joining, and be well. Take care. Bye-bye.